mums. This is a little video for you pregnant mums. So the mums that I'm seeing in my pregnancy Pilates classes, this one's for you, because I know that when you're at home, sometimes you're not confused, but you can't think of what exercises that you'd like to do from the classes that we do together on either a Monday or a Wednesday. So here are just a few exercises just to remind you of what we do so that you can do them at home. So we'll start off with a cat stretch. So that's on to your hands and knees, looking down and making sure that your knees are hip distance apart and your hands are shoulder distance apart. Then I want you to pull the shoulders down away from your ears, lengthening the head away from the shoulders, and then just gently drawing baby in towards the spine. So we're not letting the baby pull us down and dip the lower back. We're trying to lift up, just lightly focusing on pulling the core in. So that's with baby. So we take a breath in to prepare. We take it nice and wide into the rib cage, and as you breathe out, we tilt the pubic bone towards the rib cage, pushing up through the spine into our nice curved shape. We take a breath in to hold, and then as you breathe out, we lengthen out through the spine, sliding the shoulders down away from the ears and lengthening the head away. Take a breath in again. Breath out to tilt the pelvis under. So draw pubic bone towards baby, pushing the spine up towards the ceiling, looking down towards your knees or your bump, holding for that big stretch, and then breath out to move and lengthen. Just remember, we're not dipping back into that flex spine. We want to go back into a neutral spine. So just be careful if you can do this in front of a mirror, or just get somebody to check that you're not dipping your lower back. You want to come back into a neutral spine. We'll do one more. Breath in. Breath out to tilt the pelvis, pubic bone towards the baby, lifting up, drawing baby and hugging baby into the spine, pushing through the hands to get that stretch into your back. Breath in and then breath out to move. Okay, so if you like child's pose, you can just take your knees a little bit wider if your bump is a little bit bigger now, if you're in third trimester. And then you can sit back into child's pose, just resting your head down, reaching the arms away and getting that nice stretch into your lower back and into your shoulders. Remembering that this is the posture, the position where your pelvis is at its widest. So if you, when you get to labour, at the early stages, and you're feeling a bit uncomfortable in your lower back, this might be a nice comforting position to be in. So we come back onto our hands and knees, and then we can begin the pelvic circles. So this again will be a nice one to do in labour if you feel that this is something that you would like to do. I know when you get into labour, some of these exercises you think absolutely no way, it's not what I want to do, I need to be doing something else. So we're just circling the pelvis around, starting small and then growing bigger. So you're taking the circle bigger each time, really starting to use the upper body as well as you circle around all the way. When you've got to the biggest circle, reverse the circle, starting big, and then we're coming to the smaller circle to finish with. So we're going the opposite direction, widening the pelvis with each one. So this is really helping for mums in the third trimester, especially those last few weeks, to get baby down into the birth canal. So encouraging that widening of your pelvis. And then once you've done the smaller circle in this direction, we come back to our stationary position. Just reposition your hands if you need to bring your knees back underneath your hips and your hands underneath your shoulders. And then we'll do some spine stretches. We reach one arm up, so you're looking up towards the hand to the ceiling. That's your breath in. And then as you breathe out, we draw baby in and we send that hand through. We look behind. A little bit of a sit back as well if that feels comfortable. And then we breathe in to open up. Breathing out to send the hand through. Stick your bum back and breathing in again. Breathing out, do 4 on each side, breathing in, stretching and opening, really nice stretch for opening up through the posture. And then the other side, we lift up, spine stretch, breathing out, draw baby in, reaching the arm through. And breathing in, big stretch, opening up, breathing out. This is a great one for my postnatal mums as well, because they spend most of their time holding babies. So this one's a really good stretch for opening up through the front of the chest. Last one, breathing out. Good, and then placing your hands back down. We'll then do half a cat stretch position, so pelvic tilt on your elbows. So we're just going to focus on the lower part of your pelvis and your lower back. So we take a breath in, we breathe out, to tilt baby in towards you, breathe in to release. Breathing out, breathing in. So we're shortening the distance between the pubic bone and the rib cage as we draw baby in, and we stretch that lower spine, which a lot of new pregnant mums can feel, that their lower back starts to become a bit niggly as your bump gets bigger, just because your abdominals are moving further away from your centre. So that keeping that transverse abdominis muscle strong helps us in pregnancy and then postnatally. So it's breathing out as we tilt, drawing baby in, breathing into release. One more, breath out, breath into release, and then we push back onto our hands. Child's pose position, if you feel you need to have a bit of a rest there in child's pose, you can reach your arms away, stretching. And I'll do one more in this video. This is the swimming prep, so it's the leg and the arm extensions. So I want you to imagine that we've got 4 cups of tea on our back, 2 on each shoulder and 2 on our hips, and we're trying to keep these cups of tea really still. So we take a breath in, prepare, we breathe out to draw baby in towards us, and we straighten out one arm, but keeping the cup of tea on the shoulder really still. Change to the side, breathing out the other side, reaching the arms away, breathing in. Then we switch to the leg. We breathe out to prepare first, think about which leg's going to go, keeping your cup of tea still, we straighten out the leg, which I can't do because the settee's there. Breathing in to come back. Changing to the side, keeping your cup of tea still, breathing out, lengthening that leg away. So just make sure you've got enough room when you're doing this at home and you don't have the settee in the behind you. Breath out and we go through the arms again. Breath in to come back. Breath out to keep the cup of tea still, so we're sliding the shoulder down away from the ear, stabilising through the shoulders. Breathing in to come back. Then the legs again, breath out, transfer the weight onto one leg as the one leg slides away. Breathing in to bring it back. Other side, breathing out to slide away. Focusing on that cup of tea, staying still in your pelvis. So if you feel confident and you want to go a little bit further, you can take opposite hand with opposite leg. If your wrists become a little bit niggly, remember, just give them a bit of a shake off, a bit of a rub, or you can do this resting on your fist, just to take the angle off the wrist. So you can do that, or if you're fine just having a break, come back onto your hands. So when we're taking the opposite arm and leg away, focusing on the cups of tea, staying still on the shoulders and the hips, we take a breath in to prepare. As we breathe out, we hug baby in towards the spine, and we take one arm with one leg and extending away. Breathing in to slide it back under, transferring that weight onto the side, we breathe out. Breath in to come back. Other side, breath out to slide the shoulders down, keeping your cup of tea really still. Try not to look at the DVD or the video as you're doing this. Try and keep looking down at the floor. Breathing out to extend arm and leg away. Breathing in to come back. One more on each side. Breath out to draw baby in. Breathing in to come back. One more, breath out. Breath in to come back, and then just rest in child's pose again. So there's a few little exercises to do. Remember, my philosophy is that a little bit of exercise is better than nothing. So even if you just have 10 minutes to do something, it's better than nothing. Don't forget your all-important pelvic floor lifts as well. I'll do a separate DVD, separate video for the pelvic floor lifts. So I'll see you on the next video.